So what vaginal rejuvenation is, there's a lot of different things, but what we do at Wellness for Life is with PRP, which is platelet-rich plasma, PRFM, which has a fiber matrix in it, otherwise known as some stem cell therapy. But this is drawn from you and then re-injected. So what we use this for is generally postmenopausal vaginal atrophy. As estrogen leaves the tissues, the vaginal tissues and a lot of other tissues kind of dry up, and things can be very unpleasant. It can hurt to even wipe, it can hurt to walk. Definitely sex can be quite painful. And then you lead more risk of having urinary tract infections, bacterial vaginosis, even yeast infections. As the vaginal microbiome kind of dries up due to a lack of estrogen, all kinds of different things happen in that arena because of the bacteria that's present. The other thing that can happen as that tissue becomes weaker and weaker is that you're looking at vaginal prolapse, or bladder prolapse, rectal prolapse. You know, I kind of make a joke about it when I talk with my patients, but you know, it's like you don't want your bladder sitting beside you. Everything as we age kind of wants to fall into the vagina, and so keeping really tight tissue inside of there, nice thick plump tissue, is really key. So for that, we're looking at vaginal estrogen as well as doing this vaginal rejuvenation with the PRP. So this gets injected into the vaginal walls and then around the urethra, which is going to be really helpful for stress incontinence. So up to 90% of postmenopausal women report some kinds of stress incontinence. And that's when you laugh, sneeze, jump, and you pee a little bit. Or sometimes you're playing golf and you pee a lot of it. Or you get up and you just can't quite make it to the bathroom. All of those things are generally being caused by a lack of tissue surrounding the urethra. So as the urethra is kind of more free-floating, it becomes very difficult to control your urine. And I have had women, when I ask this question, tell me, well, I pee just, the normal amount. There is no normal amount to pee in your pants. It is not okay once you're a grown-up. So really, if this is what's happening to you, we need to do something about it. Kegels are super important. Exercising that pelvic floor. There's pelvic floor therapists that are amazing. And so this is not a, let's just do this one thing and you're going to be fine. This is part of a whole package. So depending on how advanced the incontinence and the atrophy is, definitely referring out to a pelvic floor specialist is totally one of the things that I do, as well as educating you on how to do proper Kegels, the vaginal estrogen, and then also doing the stem cell injections. So in addition to the two places I already said that we inject, we also inject around the clitoris. So as we age, that also ages and sometimes is not as sensitive as it used to be. So injecting into that area can increase sensitivity and also increase the look of how your genital area used to look when you were in your 20s and 30s. Things do change and we don't always love those aged appearance no matter what skin we're looking at. So if you have any questions about vaginal rejuvenation, if you're right for it, if it's the thing that you should do, please schedule a consultation. I will be happy to talk about that as well as all of your healthcare needs.